If you are taking Amlodipine, Losartan or Lisinopril right now, stop and watch this entire video before you take your next dose, because there are things happening inside your body that your doctor may never have mentioned, and some of them could be quietly making your situation worse. I'm Dr. Andre Tavares, and I've spent over 2 decades working with older adults managing cardiovascular disease. What I'm about to share with you today is not meant to replace your doctor's advice, but it is meant to fill in the gaps that a 5-minute office visit never can. Before I start, I want to ask you something simple. How old are you? Drop your age in the comments right now. I read every single one, and I genuinely want to know who is watching this, because everything I'm going to share today is specifically about what happens to your body after 60. And if you're new here, please subscribe and hit that notification bell right now. I put out videos every week specifically for people in their 60s, 70s, and 80s. And this community is growing fast because the information we share here is the kind most people only wish someone had told them sooner. Now here's what I want you to stay for. Somewhere in this countdown, I'm going to tell you about a little-known interaction that affects nearly 40% of seniors on these medications, and most people on this list have no idea it's happening to them. Make sure you stay until the very end, because that one could genuinely change how you feel every single day. A 2021 study published through the American Heart Association tracked over 14,000 adults aged 65 and older who were prescribed one of these 3 medications. What they found was remarkable. Nearly 62% of those patients were experiencing suboptimal outcomes, not because the medication wasn't working, but because of lifestyle and biological factors that were never addressed. That means the pill was only doing part of the job. The rest was being left on the table. Before we dive in, I want to ask you something personal. When you were first put on one of these blood pressure medications, did anyone sit down with you and explain exactly how it works, what it interacts with, or what you should be doing alongside it? Write your answer in the comments below. I read every comment on this channel, and your answer genuinely helps me understand what topics to cover next. You are not just a viewer to me. You are the reason I make these videos. Let's get into it. We're counting down from 5 to 1, from important to absolutely critical. Number 5, you are probably taking your medication at the wrong time of day, and it is quietly reducing how well it works. This sounds almost too simple to matter, but the research tells a completely different story. A landmark study from the University of Vigo in Spain, involving over 19,000 hypertensive patients, found that people who took their blood pressure medication at bedtime rather than in the morning had a 45% lower risk of heart attack, stroke, and cardiovascular death. 45%. That is not a small number. Here is why this matters so much more after 60. Your body follows what scientists call a circadian rhythm. Think of it like an internal clock that controls hundreds of biological processes. Blood pressure is not constant throughout the day. It naturally dips while you sleep and then surges in the early morning hours, often between 4 and 8 a.m. This surge is actually when most heart attacks and strokes occur in older adults. By taking your Amlodipine, Losartan, or Lisinopril at night, you are placing the medication's peak effectiveness right at the most dangerous window. After age 70, the circadian clock becomes less precise, meaning this morning surge can be more dramatic and less predictable. Nighttime dosing helps smooth that out. A patient of mine named Harold, 74, from Scottsdale, Arizona, had been on Amlodipine for 3 years with decent but inconsistent readings. We simply shifted his dose to 8 p.m. Within 6 weeks, his morning readings dropped by an average of 11 points systolic. No change in medication, no change in diet, just timing. Speak to your doctor about whether a bedtime dose makes sense for your specific medication and situation. Number 4, grapefruit is not just a breakfast fruit. For people on these medications, it can behave more like a drug. I know this sounds dramatic, but bear with me, because the mechanism here is genuinely fascinating and genuinely important. Grapefruit and grapefruit juice contain compounds called furanocoumarins, which block a specific enzyme in your intestine called CYP3A4. Think of that enzyme like a traffic controller that regulates how much medication gets absorbed into your bloodstream. When grapefruit shuts that controller down, significantly more of your medication enters your system than intended. For amlodipine specifically, studies have shown that grapefruit can increase the drug's blood concentration by up to 60% in some individuals. That means the dose your doctor prescribed can essentially become a much higher dose without either of you knowing it. The result can be blood pressure that drops too low, leading to dizziness, falls, fainting, and in older adults, falls are not a minor inconvenience. According to the Centers for Disease Control and Prevention, falls are the leading cause of fatal injury among adults over 65. After 75, the liver's ability to process medications slows by nearly 30% compared to younger adults, which makes this interaction even more potent. It is not just grapefruit juice either. Whole grapefruit, grapefruit sections, and even some grapefruit-flavored products can trigger this effect. The interaction can last up to 24 hours from the time of consumption. If you love grapefruit, talk to your doctor. There may be options, but please do not assume it is harmless just because it is fruit. I want to pause here and ask, where in the world are you watching this right now? Drop your country and your city in the comments below. I have viewers from across the United States, the United Kingdom, Canada, Australia, South Africa, and so many other places, and I love seeing where this community reaches. You are never watching alone. And if you are finding this video helpful, please take 3 seconds right now to hit the like button and subscribe if you have not already. It tells YouTube that this content is worth sharing with more seniors who need it, and that is exactly who we are trying to reach. Number 3. If you are taking Lisinopril or Losartan, potassium is playing a much bigger role in your treatment than you may realize, and getting it wrong goes in both directions. Here is what most people do not know. Lisinopril is an ACE inhibitor and Losartan is an ARB, an angiotensin receptor blocker. Both of these medication classes cause your kidneys to retain potassium instead of excreting it. This is not a side effect to ignore. It is a central part of how the medication affects your blood pressure, but it also means that your potassium levels require careful management. Too little potassium causes the heart muscle to become irritable and can make blood pressure harder to control. Too much potassium, a condition called hyperkalemia, can cause dangerous heart rhythm disturbances. The kidneys in adults over 65 filter blood at a rate that is on average 30 to 40% slower than in younger adults, meaning potassium can accumulate more easily. A 2019 analysis from Johns Hopkins University found that nearly 23% of older adults on ACE inhibitors or ARBs had potassium levels outside the optimal therapeutic range, and the majority of those patients were completely unaware of it. Margaret, 71, from Birmingham in the United Kingdom, came to my attention after complaining of persistent muscle weakness and irregular heartbeat. Her lisinopril dose had not changed in 4 years, but her diet had shifted toward more whole foods, including bananas, sweet potatoes, and leafy greens, all high in potassium. Her levels had crept into the danger zone silently. The practical guidance here is this. If you are on Lisinopril or Losartan, ask your doctor for a potassium level check at every routine visit. Do not supplement potassium without medical guidance. Eat a balanced diet, and if you make significant dietary changes, mention them to your healthcare provider. This is one interaction that a simple blood test can monitor and control completely, but only if someone thinks to check. Number 2. Dehydration silently amplifies the effects of all 3 of these medications. And seniors are the most vulnerable population on the planet when it comes to recognizing thirst. This is the one I teased at the beginning. Research from the National Institute on Aging has confirmed something that surprises many people. The thirst mechanism weakens significantly with age. By the time many adults in their 70s feel thirsty, they are already mildly to moderately dehydrated. And when you are even mildly dehydrated, the blood volume in your body decreases, meaning these medications, which are already working to lower pressure, can push that pressure too low. The medical term for this is hypotension, and in practical terms, it means dizziness when you stand up, lightheadedness during exertion, confusion, fatigue, and an elevated fall risk. A 2020 study from the University of California, Los Angeles, found that among seniors on antihypertensive medications who were admitted to the emergency room for falls, over 58% were found to be dehydrated at the time of the fall. After age 65, the kidneys also become less efficient at conserving water, meaning your body loses fluid more easily and replaces it less efficiently. This makes deliberate hydration not optional. It is medically necessary. For most older adults on these medications, the goal should be around 6 to 8 glasses of water per day, spread throughout the day, rather than consumed all at once. Coffee and tea count in moderation. Alcohol does not. It actively depletes fluid. A man named Joseph, 78, from Tampa, Florida, had been falling sporadically for 8 months. 3 different specialists had evaluated him. Nobody had asked about his water intake in detail. When we tracked it, he was consuming fewer than 3 cups of fluid per day. Within 3 weeks of structured hydration, his dizzy spells stopped entirely. Number 1. The single most overlooked threat for seniors on these 3 medications is unmonitored low blood pressure, not high blood pressure. We spend so much energy worrying about pressure being too high that we forget it can swing too far in the other direction. And when it does, the consequences for older adults are severe. The medical community calls this overtreatment, and it is far more common than most people realize. A 2022 meta-analysis in the Journal of the American Geriatric Society examined over 30,000 seniors, aged 70 and older, on antihypertensive medications. They found that patients whose systolic blood pressure was brought below 120 had significantly higher rates of falls, cognitive decline, kidney injury, and mortality compared to those maintained at slightly higher levels. The body of an 80-year-old is simply not the same as the body of a 45-year-old. The brain, the kidneys, and the heart all depend on adequate perfusion pressure, meaning sufficient blood flow, to function properly. Overcorrecting that pressure can starve those organs of what they need. Elena, 69, from Melbourne, Australia, came to me after experiencing 3 months of brain fog, extreme fatigue, and what she described as feeling constantly disconnected. Her blood pressure readings at home were regularly coming in at 110/65. Her doctor, well-intentioned, had simply followed the standard guidelines without adjusting for her age-related physiology. We worked with her cardiologist to slightly reduce her amlodipine dose. Within 1 month, Elena described it as getting her life back. If you are a senior on any of these medications, I want you to monitor your blood pressure at home, not just in the office, and bring those numbers to your doctor. Blood pressure can be falsely elevated in a clinical setting due to something called white coat hypertension. What your doctor sees and what your body actually experiences every day can be very different. Home readings give a far more accurate picture. Discuss with your doctor what your personal target range should be, given your age, kidney function, and overall health. There is no universal number that is right for everyone. Let me close by saying this directly. The goal of managing your blood pressure is not just to lower a number on a chart. It is to protect your ability to live fully, to walk with your grandchildren, to travel, to enjoy your meals, to wake up every morning feeling capable and clear. These medications, used wisely, can extend and protect that life beautifully. But they require partnership between you, your doctor, and the information you bring to those conversations. It is never too late to ask better questions, to understand what is happening in your body, and to take an active role in your own health. You deserve that, and you are worth the effort. Thank you so much for being here today. It genuinely means the world to me that you give your time and your trust to this channel, and I do not take that lightly. Scientific references for everything discussed in this video are listed in the description below. If you are not subscribed yet, please do that right now. And leave me a comment telling me, are you personally taking one of these blood pressure medications, or is someone you love? If it's a loved one, write their name or how they are related to you in the comments. And if this video helped you, please share it with someone who needs it. That one share could genuinely change someone's life. I will see you in the next video.